Om Swastiastu, Assalamualaikum warahmatullahi wabarakatuh. Shalom, Namo Buddhaya for all of us. We are here, SGD B7, are going to do a presentation about our student project titled Vitamin D Metabolism in Acute and Chronic Inflammation or Infection. Next slide. These are our group members.
Let me introduce myself. My name is Ngurah Agung Rahadi Aryawangsa. With my last three-digit number is 144. I will explain about the background information. Vitamin D is a fat-soluble vitamin that can be obtained through food, as well as a psychosteroidal hormone that is produced in the skin when ultraviolet B from sunlight reaches the skin. Our focus in this topic is biological background, evidence from epidemiological studies, as well as intervention studies with vitamin D in COVID-19. Next. So there are 6 problems that we will discuss in this topic. The problems are, what is the function of vitamin D in the human body? What are the sources of vitamin D? How does the body metabolize vitamin D? What are the benefits of vitamin D on inflammation and infection? What are the symptoms and complications of deficiency or excess of vitamin D? And the last one, what are the non-pharmacological and pharmacological therapy for vitamin D deficiency? Next.
Next, my name is Leonyta Augustyne with the last 3 digits 150. The student project has a lot of objectives for readers to learn more about the function, the food sources, and the mechanism of vitamin D metabolism process. The aim of this project is also to learn about the vitamin D benefits on inflammation and infection, identify the symptoms and complications due to vitamin D deficiency, and to find out the non-pharmacological and pharmacological therapy for vitamin D deficiency. Next. The benefit of writing this student project is to expand the knowledge about vitamin D and its function, chemical structure, the source of vitamin D, and also the importance and benefits of vitamin D, along with the explanation of vitamin D metabolism process in the human body. That's all from us. That's all from us for the first chapter. Thank you.
The next point will be presented by me, Nilputama with the last 3-digit number 155. Next. So vitamin D is a fat-soluble vitamin found in food and dietary supplements. It is also referred as calciferol. Vitamin D is divided into 2 main types, vitamin D2 and D3. The main difference between those is the source. Vitamin D3 tends to be obtained through animals or meat. Meanwhile, vitamin D2 is produced in plants and fungi. Well, at first there was a debate between scientists that vitamin D was a hormone because skin cells can produce vitamin D with the help of sunlight. However, it was later agreed that vitamin D is a vitamin. Next. The primary function of vitamin D, which is quite well known, is strengthening bones, also plays a role in the body's metabolism, including the process of urinary excretion and bone growth. Vitamin D also increases muscle strength, therefore weakened muscle tone is one of the signs of vitamin D deficiency. It is also crucial for the body's immunity and its role as an antioxidant to fight free radicals, and also useful in phagocytic activity, the production of antimicrobial substance in phagocyte, increasing immunity and treating inflammation. Therefore, the role of vitamin D for the body is vital and diverse.
Next, okay, so let me introduce myself. I'm Valerie with the last 3 digits 143, and I'm going to present about the chemical structure of vitamin D. C27H44 or O, or better known as vitamin D, is a complex made from lipophilic molecules. Vitamin D is synthesized by 2 sources, cutaneous synthesis and diet. Next. Most of the time, vitamin D found circulating in our bodies in the 25-hydroxyvitamin D3 or calcidiol form. Calcidiol is a product of the process of hydroxylating vitamin D by a cytochrome P450 enzymes such as CYP2R1, CYP27A1, and CYP2D25. CYP27B1 are also known as renal 25-hydroxyvitamin D3, 1-alpha hydroxylase, or mitochondrial CYP27B1 is produced by the macrophages. CYP27B1 plays a part in producing and circulating calcitriol. Next. DBP is a highly polymorphic with 3 common variants that affect protein functions, which is GC1F, GC1S, and GC2. DBP functions as a binding protein for vitamin D metabolites in the serum, binding fatty acids, sequesters actin, and act as a chemotactic factors in neutrophil recruitment. CYP24A1 is a mitochondrial inner membrane cytochrome P450 enzyme that is present in all cells. CYP24A1 takes a part in hydroxylating calcifidiol in the kidney, hydroxylate calcitriol, catalyze C23 oxidation, and formation of calcitriol 26-23 lactone. Next. Vitamin D receptor, or VDR, mediates biological actions of calcitriol. VDR protein consists of 427 amino acids. The core functional domain of VDR is divided into 2: DNA binding domain, DBD, a highly conserved NH2 terminal, and a ligand binding domain, LBD, a more variable COOH terminal. These domains are connected through a hinge region that stabilizes the whole complex. Next.
Okay, let me introduce myself. My name is Bryan Tjandra with the last digit of my name 152, and I will explain the source of vitamin D. In this presentation, there will be 5 major sources of vitamin D. The first one is salmon with 3 types. The first one, Atlantic salmon, with 18.5 micrograms of vitamin D per 100 gram serving. Second one is North Sea salmon with 9.4 micrograms per 100 gram serving. And the last one is farm salmon with 2.9 to 9.5 micrograms of vitamin D per 100 gram serving. The second source is egg, and there's 2 types of eggs here. The first one is free-range egg, ranging from 3.1 micrograms per 100 gram serving in Perth to 9 micrograms per 100 gram serving in Brisbane. And the second type of egg is caged egg with 3.6 micrograms per 100 gram serving in Perth to 7 micrograms per 100 grams of serving in Melbourne and Adelaide.
Okay, before I continue, let me introduce myself. My name is Marina Nugrahani with the last 3-digit number 140. Okay, the next vitamin D source is cod liver oil. It has high amount of vitamin D per gram, about 448 international unit per 4.9 milliliter cod liver oil. Next. And the next one is vitamin D supplement. Next. And the last one is mushrooms. Mushrooms have different types. The first one is fresh wild mushrooms. It has 35 micrograms of vitamin D per 100 gram serving. The next one is fresh retail mushrooms. It has less than 1 micrograms of vitamin D per 100 gram serving. The third one is fresh mushroom exposed to sunlight. It has 70.5 micrograms of vitamin D per 100 grams serving. And the last one is fresh mushroom exposed to UV radiation. It has 20 micrograms to 178 micrograms of vitamin D per 100 gram of serving. Next.
Okay, let me introduce myself first. My name is Stella Angeline Isbianto, and my last 3 digits are 142. And now I will explain about the metabolism of vitamin D. Next slide. Okay, so vitamin D is a prohormone that needs to be metabolized to biologically active products that bind to their cognate nuclear receptors for the regulation of diverse physiological processes. Next slide. Okay, so here is a picture about the metabolism pathway of vitamin D. So first, let's start with the pre-hormone called 25-hydroxy vitamin D, which also known as calcidiol. So there are 2 ways the body can get 25-hydroxy vitamin D. One is from the diet, typically from either fish or dairy or from supplements, and these are called ergocalciferol or vitamin D2. And the other way the body can get 25-hydroxy vitamin D is from cholecalciferol or vitamin D3, which is synthesized from 7-dehydrocholesterol in the skin in the presence of ultraviolet light. So both vitamin D2 and D3 are equally converted to 25-hydroxy vitamin D or calcidiol in the liver via the enzyme 25-hydroxylase. And the final step in this pathway is when calcidiol is converted to the active hormone 1,25-dihydroxy vitamin D, which also called calcitriol. This step is performed under the influence of the enzyme 1-alpha-hydroxylase, a conversion occurring predominantly in the proximal nephron of the kidney. So calcitriol can also regulate its own synthesis and decrease the synthesis and secretion of parathyroid hormone. Calcitriol can also increase the expression of 24-hydroxylase, an enzyme that plays a role in the catabolism of calcitriol into water-soluble calcitroic acid, which is then excreted into the bile.
Okay, let me introduce myself. My name is Febriano Prawira with the last 3 digits of number is 156. And now I'm going to explain about benefits of vitamin D in inflammation and infection. Inflammation is the process where our immune system recognizes and removes harmful and foreign objects from our body and starts the recovery process. This can be divided into two, which is acute inflammation, which is short-term, chronic inflammation, which is long-term inflammation. The next one is infection. Infection is a condition where a microorganism invades a person's body and causes harm. This can be divided into 5 based on the causes: fungal infections, viral infections, parasitic infections, bacterial infections, and protozoan infections. Next, the role of vitamin D during an infection. So when an infection occurs, TLR2 will activate the VDR or vitamin D receptors, and these vitamin D receptors will allow vitamin D to mediate the production of cathelicidin. Cathelicidin is an antimicrobial protein that is able to kill and inhibit the growth of pathogens in our body. Next.
Okay, before I continue, first of all, let me introduce myself. My name is Dantia Widarta, with my last 3-digit number being 147. So the next point is vitamin D in inflammation or infection, acute and chronic. Inflammation occurs as a response to an antigen. It produces an inflammatory chemical that acts as a messenger with the leukocytes or immune system. Before we continue, it is important to know the difference between acute and chronic. As previously mentioned, the difference lies in their duration. Acute inflammation only lasts for several days, while chronic inflammation could last for several months or even years. However, the effects varies according to the type of illness and how well the body responds to it. It is also important to note that chronic diseases can be a continuation from an acute inflammation, or even at some cases it can be an independent response. Okay, next. Okay, however, the relation between vitamin D and chronic diseases varies from one disease to another. Some relation can be seen with cancer and cardiovascular disease. With cancer, a deficiency in vitamin D binding protein or VDBP, which carries vitamin D, could cause malignant tumors. With cardiovascular disease, when there's a low level in vitamin D, it can activate the pro-inflammatory cytokines, which can trigger a cardiovascular disease. Okay, next.
Okay, allow me to introduce myself. My name is Carla with my last 3 digits number 146. Next. Now I am going to present about complications due to deficiency or excess of vitamin D. A high frequency of vitamin D insufficiency in critically sick individuals has been linked to worse outcomes from infectious complications. Recently, it was shown that critically sick patients who were vitamin D deficient had greater comorbidities related to pneumonia severity, such as sepsis and acute respiratory distress syndrome or ARDS. Extremely low in 7 nanograms per milliliter vitamin D levels on ICU admission in critically sick septic patients may lead to poor ICU outcomes, including death and increased infection rates. Thus, according to epidemiological research, vitamin D deficiency is linked to viral respiratory tract infections and severe lung damage. The current study's findings show that vitamin D deficiency is linked to an elevated risk of COVID-19 infection and death in a variety of nations. Next.
Let me introduce myself. My name is Manullang with 3 last digit numbers is 151. So here I would like to present the symptoms of the deficiency or excess of vitamin D. Regardless of the causes, the resultant clinical syndrome is largely a reflection of impaired intestinal calcium absorption. The most clinical manifestations include hypocalcemia, bone pain, and bowing of extremities. Long-standing deficiency of vitamin D metabolites leads to impaired skeletal mineralization owing to the calcium and phosphate deficiency. Also, the symptoms of vitamin D deficiency in COVID-19 patients, especially for children patients, could be classified into 5 stages. There are 1. Asymptomatic with positive RT-PCR but no clinical manifestation. 2. Mild with the symptoms are fever, fatigue, myalgia, cough, sore throat, and nasal flow with normal respiratory. 3. moderate with the symptoms are pneumonia with fever and cough without dyspnea and hypoxemia. Fourth is severe with the symptoms are fever and cough in the early period who develop dyspnea and hypoxia. And fifth is acute respiratory distress or respiratory failure rapidly and who tend to develop shock, encephalopathy, myocardial affection, coagulation dysfunction, and acute kidney injury. Thank you, and next slide, please.
I'm Anastasia Andriatan Mirius with the last three-digit numbers 154. In this section, I'm going to present about the pharmacological and non-pharmacological approach for treating vitamin D deficiency. Next. These are the two basic terminologies. Pharmacological approach involves the use of drugs or medicine. Non-pharmacological therapy, on the other hand, means that it doesn't require any drugs or medicine. Next. Vitamin D2 is available as pharmaceutical because it predated the FDA and was grandfathered as a pharmaceutical. Vitamin D2 was found originally from UV-irradiated yeast or plant sources such as wild mushrooms and fortified foods such as milk or cereal products. Next. Vitamin D3 or cholecalciferol was never evaluated as pharmaceutical and is widely available as a supplement. It is derived from the cholesterol that originated from lanolin in sheep's wool or fish oil. Sunlight is also considered as non-pharmacological therapy. We each have vitamin D receptor cells that through a chain of reactions starting with conversion of cholesterol in the skin produce vitamin D3 when they're exposed to ultraviolet B from the sun. The sun's ultraviolet B rays hit cholesterol in the skin cells, providing the energy for vitamin D synthesis to occur. Next. The adequate intake of vitamin D for infants and adolescents is 400 IU or international units and 600 IU for elderly. Vitamin D can also be obtained from food. However, foods alone do not meet the daily requirements of vitamin D. Enough vitamin D can be obtained from being under the sun daily for a short amount of time with forearms, hands, or lower legs exposed. Sunscreen and being directly contacted to sunlight may also prevent the body from producing vitamin D in the skin. Too much sunshine ages the skin and increases the risk for skin cancer. Next. If the body could not absorb vitamin D, gastroenterologists should be consulted where pharmaceutical approach takes place. To prevent relapsing of vitamin D malabsorption, 50,000 IUs of vitamin D2 every 2 weeks is effective and safe for 6 years with maintenance dose of 2,000 to 3,000 IUs of vitamin D3 daily. Serum 25 hydroxy vitamin D levels should be measured again after therapy is completed. If minimum values have not been reached, a second week course of vitamin D2 ergo calciferol should be prescribed. Next.
Okay, my name is Anjani Prabandani Sudewa with 3 last digit 148. So I will give this conclusion and suggestion as the closing of this topic. Vitamin D is one of essential nutrients that the body needs to maintain health. In general, vitamin D is divided into two types according to the source of production, such as vitamin D2 and vitamin D3. The main function of vitamin D, which is quite well known, is strengthening bones. But besides of that, vitamin D also playing a role in the body metabolism, strengthening muscle, activating T cells for immunity, acting as antioxidant to fight radical free, and treating inflammation. Vitamin D has a role in controlling the prevention of infection and also reducing the severity of the infection. The reasons why it can be because vitamin D boosts the induction of cathelicidin in our body, which is increase the immunity to against infection. Lack of vitamin D in the body can lead to several complications, and one of them is COVID-19. COVID-19 patients who have vitamin D deficiency related to more terrible results than infectious complications. Because of that, we have to fulfill our daily vitamin D needs by consuming salmon, egg, mushroom, vitamin D supplement, or any product that contains vitamin D, also sunbathing in the morning. Okay, that's all about our presentation today. We apologize in advance if there are any mistakes. We will close with Parama Santi, Om Santi 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 Om. Wassalamualaikum warahmatullahi wabarakatuh. Shalom Budaya.